Today I thought I'd talk about pelvic floor. I was really surprised this week when I'd sort of done something on my Facebook page and found out that for a lot of people, pregnancy is the first time they really learn about the pelvic floor, and that's mostly just because it's mentioned by your midwife. So it's really important to be thinking about the pelvic floor and working on it during pregnancy to help with continence, but it can also help with continence later as well. So postnatally, there's been research that shows that if you've done some pelvic floor work, then you have less incidence of incontinence after baby. The pelvic floor is also important during labour because it turns the baby's head. So the baby has to come out of the pelvis one way, or go into the pelvis one way and then turn to get out of the pelvis, and the pelvic floor is responsible for that. So we want it to be working well for that. You won't be even conscious of it, but the more movement there is in the pelvic floor, the better. So what often happens is that people's pelvic floors don't relax. So part of labour is relaxing the pelvic floor, and if you're pushing against a resisting pelvic floor, then it's going to make it a little bit harder. So the pelvic floor work is not just about strengthening, it's about being able to relax it too. And the best way to relax your pelvic floor is actually just using your breath and taking time and just mindfulness. So if you're doing anything like hypnobirthing or something like that, then that might help you with your pelvic floor. It can also help with back pain and pelvic pain because your pelvic floor is part of your core muscles. So you've got, if you imagine a cylinder, you've got your diaphragm at the top, you've got your abdominal muscles at the front, you've got your back muscles at the back, and then the pelvic floor underneath. So those are all your core muscles, and they're designed to just pull in gently whenever you're doing anything that needs to support your back. So the muscles of the stomach are back supporters, and that's why there's a lot of low back pain in pregnancy, is just because for some people their stomach muscles will draw apart sooner, so they are supposed to draw apart to leave space for baby, but for some people that might go a bit quicker. Posture, you take a lot of sort of weight into the front line of your body, so that can pull on your back. And then just because a lot of people tend to lean into the feet and then lean back, that compresses into the back. And again, that is just a mechanism that you use to try and hold yourself upright, but it puts strain onto your lower back. Instead, if we're standing nice and upright with everything lined up, then the pelvic floor switches on, the core muscles in the stomach switch on, and then they should support better. So I'll just go through one easy way to do a pelvic floor lift and lower. So again, this is not about kegels and pulling and squeezing and holding. This is simply going to be breathing and using your pelvic floor with your breath. So the pelvic floor and the diaphragm move together. So your diaphragm moves down when you breathe in, so that it creates space in the lungs for the air to go in. And the diaphragm is actually a really big muscle, really strong muscle. So if it pushes down quite hard, then you get extra pressure in your abdominal area, and so the pelvic floor comes down with it, so that the pressure within your abdominal cavity stays the same the whole time. So that's how we're designed. So the breathing movement is that the pelvic floor should go down as you breathe in and rebound up as you breathe out. So the pelvic floor is kind of dome shaped, so it's got that space for giving outside, so sort of level with your sit bones as you sit. When you're in labour, then it can push outside of the sit bones, so you've got space for that movement. So if you have a birthing ball, then I would do this on a birthing ball, just because the ball pushes into your perineum a little bit, into those pelvic floor muscles there, and so you might actually feel the pelvic floor connection a little bit easier. So especially if you're not really used to doing anything, then that's a good little bit of feedback from the birthing ball. So all you're going to do is, as you breathe in, try and feel like the breath comes all the way down to the pelvic floor, and feel that you can lengthen the pelvic floor. So you just want to feel, if you're on that ball, feel that you get that little connection, that lengthening, that softening, but not a pushing down. So you're not bearing down, you're not trying to strain. It's just an easy kind of release. And then as you breathe out, then you can feel that rebound back up, and you can add to that a little bit. So you get a little bit of a lift up, and then as you breathe in, let it relax down again. So you're just going to keep going. So you're really trying to feel that the breath goes to the pelvic floor, and then as you breathe out, then everything's drawing back up and your breath's coming out of the top of your head. It's not, but that's what we want to feel, is that lift and lower. So it's north to south breathing in all the way down to your pelvic floor, let it relax, breathing out, let it draw from the pelvic floor up, and so you get that movement of upwards feeling rather than a kind of pushing out or a pulling in of the stomach. You want to feel of a down and up movement. So just get that sense of relaxation, of length through the pelvic floor, of softness on your breath in, and then as you breathe out, you can either think of it almost like an elephant's trunk. This is my least favourite analogy, but there we go. An elephant's trunk drawing in and lifting up. So when you do a pelvic floor lift, it should be a sense of inwards and upwards. So just drawing in and lifting up, and getting that just with the breath out, and again breathing in, just let it go. So again, we're not looking for big holds, we're not looking for a big movement, and I want you to focus in on the breath in and the relaxation just as much, and especially if you're nearing D-Day, B-Day, whatever you want to call it, that you're focusing on the relaxation side of it, because that will help in your labour, and you just want to feel that you can just let that pelvic floor release a little bit more. So you want to just focus on your breath as you do it, so that you can get that relaxation. So if you can, just take yourself off and just do it quietly, and that you just want to feel that there's a softening when you breathe in, not a bearing down. And if you're not sure of how to do a lift, let me know, and I shall give you some other ways of doing it. So hopefully, as I say, that is helpful. You need any help, just let me know. Always happy to talk about the pelvic floor, and now I'm on a mission to talk about it more, knowing that most people didn't know about it until pregnancy. So forgive me if you've heard it all before. All right, take care. I shall see you soon.